ओबीएस में स्ट्रीम की सेम है। Hello everybody, am I audible and visible? Hello everybody, am I audible and visible? Good afternoon, can you all hear me guys? Okay, so good to see all of you after this very long time. काफ़ी time हो गया, right? And now that FMG exams are just round the corner, we couldn't have delayed. मतलब और time नहीं ले सकते थे. We had to start this short revision session. Okay, so I'm sure that this is going to benefit all of you like we did it. We've always been doing it. Okay, so guys, all I want from all of you is कि इन sessions में particular रहना है. And I've shared this schedule on my Telegram group as well. ठीक है, volume, is it okay now? Always been doing it. Okay, all right, so yeah, good afternoon guys. So ठीक है, so I have shared the roster on the Telegram group as well. Now this is the roster that we are going to follow guys. Today is the first class on epidemiology and I will try कि हर एक session 1 hour में we are able to wrap it up. ठीक है, and this is completely an MCQ based session. Okay, completely an MCQ based session. All important things will be revised with the help of MCQs guys. ठीक है, सारे MCQs के through ही हम लोग रिवाइज करेंगे. एंड एनीबडी हु इज नॉट एबल टू अंडरस्टैंड एनीथिंग, यू कैन कीप इट डाउन, यू कैन नोट इट डाउन. जब सेशन खत्म हो जाएगा देन आई एम गोइंग टू डिस्कस इट विद यू. ओके, इफ यू हैव एनी डाउट, नोबडी इज गोइंग टू टेक होम एनी डाउट विद देम. ठीक है, प्लस देख लो यूट्यूब लाइव इज गोइंग टू हैपन एट 2 PM एंड इंस्टाग्राम में अगर हो तो ठीक है, आई विल कीप गिविंग इंस्टाग्राम स्टोरीज फॉर एपिड टुडे, बट टेलीग्राम क्विज विल हैपन एट 8 PM. और मैं ऑडियो मैसेजेस देने की पूरी कोशिश करूंगी गाइज. अगर थोड़ा सा लेट हो जाए देन यू हैव टू लेट मी नो. नाउ द वॉल्यूम इज ओके गाइज. Instagram stories for can I begin? Can we begin the session everybody? Am I audible and visible? Because I don't want to delay. अब now you are in the preparatory phase और इस समय बिल्कुल समय waste नहीं होना चाहिए. ठीक है, everybody is with me, give me a thumbs up. This is the roster. Tomorrow is 30th November. Your class will be on screening and 17th December would be one more session, the last session. ठीक है, but हाँ, but एक update का भी session होगा which will happen after 20th December. ठीक है, चलो let's start guys. So before I go any forward, just wanted to give you that one person's name. Who is he? He is John M. Last. Okay, who gave the definition of epid. Okay, he gave the definition of epid. Before I go to MCQs, just a quick revision कि epidemiology, yes, PDF will be shared, don't worry, PDF मैं पक्का शेयर करूंगी Telegram group में after the session is over. ठीक है, after the session is over. Okay, now he is John M. Last who gave the definition of epidemiology. Anybody has any more questions, please keep it with you. ठीक है, and as the session finishes आप मेरे से MCQ questions पूछोगे. ठीक है, I will extend the session for 5 minutes 10 minutes to address all your doubts. ठीक है, एक और slide before we move forward. What is the definition of epidemiology? I hope all of you know. We study 3 things: distribution, determinants and frequency. ठीक है, 3 things पढ़ना है of diseases and apply this to control the diseases. ठीक है, all right. So yes, this is beneficial for NEET PG as well. You can do it because it's going to be an MCQ based session. ठीक है, all right. Also look at this next slide of the day. After that we will be switching over to MCQs. ठीक है, ठीक है, yes, you can follow the roster guys. The roster I have already shared. उसको roster को follow करो और सारे topics discuss होंगे. One last thing, NEET PG, FMG, everybody के लिए sessions are useful because all we'll be doing is discussing MCQs. So now I'm starting with the questions. This is the type of epidemiological study design. This is a PYQ based slide. Just look at me. What are the 2 major classification of study designs guys? एक होता है observational, ओके, एक होता है एक्सपेरिमेंटल. ऑब्जर्वेशनल में क्या होता है, डिस्क्रिप्टिव एंड एनालिटिकल. डिस्क्रिप्टिव में वी डिस्क्राइब अकॉर्डिंग टू टाइम, प्लेस एंड पर्सन, ओके, एंड एनालिटिकल में वी आर ऑलवेज कंपेयरिंग. सो व्हाट आर द एग्जांपल्स ऑफ डिस्क्रिप्टिव स्टडी डिजाइंस? केस रिपोर्ट एंड केस सीरीज. ठीक है, जस्ट कीप फॉलोइंग, सिट विद अ कप ऑफ टी एंड कॉफी, पीडीएफ विल बी गिवन टू यू, एब्सोल्युटली नो वरीज. ठीक है, तो एक होता है डिस्क्रिप्टिव, केस रिपोर्ट एंड केस सीरीज. दूसरा होता है एनालिटिकल. एनालिटिकल में वी विल ऑलवेज कंपेयर. So there is a comparison group, okay? Comparison group में you have 4: ecological, cross-sectional, case control, cohort. All the synonyms are also given over here, guys. कि ecological को we also call as correlational study. All the study designs will be discussed. Cross-sectional is prevalence study. Case control is case reference. Cohort is always a follow-up study. Okay, experimental में RCT, field trials, community trials. Now look at one more thing. All study designs, okay, have individuals as unit of study. Which one has population? Ecological. So this is a PYQ. Okay, ecological study design has population as unit of study. ठीक है, so these were 2 things for you to revise. John M. last, definition of epidemiology, classification of study designs. अब हम लोग चलते हैं MCQ पे. रेडी सारे कोई MCQ करने के लिए तैयार? एवरीबडी इज रेडी. सो फर्स्ट MCQ, वी हैव ऑलमोस्ट 20 to 25 MCQs फॉर एपिड टुडे. ओके, ऑल राइट, मूविंग फॉरवर्ड. नेक्स्ट MCQ guys, first one. Hypothesis is not tested by, let's see, hypothesis is not tested by descriptive study, analytical study, case control study, cohort study. Take your time. Imagine कि this question is flashing on the computer screen in front of you. ठीक है, no rush, थोड़ा सा एक्स्ट्रा समय लग जाएगा. I am there, you are there, बट सारे सॉल्व करके जाएंगे. ठीक है, सो हाइपोथेसिस, इसमें एक MCQ है. हाइपोथेसिस मीन्स एन assumption. Okay, hypothesis is an assumption which is yet to be verified. Okay, now we all know that there are 3 things that we do. Hypothesis formation. Hypothesis formation कौन सी स्टडी डिज़ाइन करता है? Hypothesis formation के लिए होता है descriptive study design. Okay, hypothesis testing के लिए we have analytical study design, and hypothesis confirmation के लिए what do you have guys? Hypothesis confirmation, it is nothing but interventional study design. Interventional, or you could also call it as experimental. So now instead of asking you directly, मैंने क्या पूछा है? Not tested by. So is it tested by descriptive study designs? No. Descriptive study designs will help you in formation of hypothesis. Clear? अब analytical, case control, cohort, they are all analytical study designs. So ये हमें क्या करने में मदद करता है? They help us in testing. Done with the first MCQ. Instead of asking you directly, this is how a question can come up. Hypothesis is not tested by. ठीक है? So question number 1. You can score yourself also. आप अपने को भी स्कोर करो. ठीक है, जितने भी क्वेश्चंस होंगे, try scoring yourself. Going to question number 2. Question number 2nd. Okay, all right. Interventional study is used for, again, question number 2. Interventional study is used for, just a quick repeat. Hypothesis formation, hypothesis testing, hypothesis confirmation, hypothesis manipulation. Oh, that I won't be able to do it in the middle, Dikshit. From tomorrow it won't come. I think it might have skipped my mind. So from tomorrow I'll make sure that ads don't pop up in between. Okay, I'm so sorry for it. अभी तो मैं नहीं कर पाऊंगी, कल से मैं देखती हूँ. ठीक है, I'll do it. All right, interventional study is used for, very good, hypothesis confirmation. 2 questions done. We've revised the basic. Going to next question. Let's see if you can do it. Question number 3 for the day. A new disease X is being reported, okay, a new disease X is being reported about which nothing is known. ठीक है, which epidemiological study is the first choice to assess the unknown disease? अभी एक new disease आया, let's say COVID has come up. Okay, did we know it was COVID? नो. व्हाट वर वी कॉलिंग इट एज न्यूमोनिया ऑफ अननोन ओरिजिन. ठीक है, तो जब कोई नई डिजीज आती है, व्हेन देयर इज समथिंग न्यू दैट कम्स अप, व्हाट इज द फर्स्ट स्टडी डिजाइन दैट यू वुड वांट टू डू एवरीबडी? वेरी गुड गाइस, मोस्ट ऑफ यू आर राइटिंग करेक्ट. नॉट अ केस कंट्रोल. व्हाट वाज माय प्रायोरिटी? डिस्क्रिप्टिव. Okay, when COVID came in 2019, I am an epidemiologist. हमें नहीं पता था कि वो कोविड है. ठीक है, what were we calling it as? We called it as pneumonia of unknown origin. इसीलिए अब सबसे पहला स्टेप क्या करना है? उस डिजीज को हमें डिस्क्राइब करना है. डिस्क्राइब इन टर्म्स ऑफ टाइम, प्लेस, पर्सन. इसका मतलब डिस्क्रिप्टिव स्टडी के साथ what is your buzzword guys? Your buzzword is distribution. Okay, your buzzword is distribution. Another thing, कभी भी एग्जाम में इफ यू सी द वर्ड न्यू डिजीज, नथिंग इज नोन, ठीक है, नथिंग इज नोन, ओके, और न्यू डिजीज ऑफ अननोन इटियोलॉजी, ओके, न्यू डिजीज ऑफ अननोन इटियोलॉजी, तो सबसे पहले हम लोग क्या करना चाहेंगे? द फर्स्ट एंड फॉरमोस्ट थिंग दैट वी वुड वांट टू डू इज ऑलवेज डिस्क्राइब. क्लियर एवरीबडी? ठीक है, कोई नया डिजीज आया, हमको कुछ नहीं पता उसके बारे में, सो व्हाट इज द फर्स्ट थिंग दैट आई शुड डू? आई शुड डिस्क्राइब इन टर्म्स ऑफ टाइम, प्लेस एंड पर्सन. ऑलराइट, एवरीबडी गॉट दिस क्वेश्चन? ठीक है, डोंट वरी तेजस, ऑल योर डाउट्स विल बी टेकन अप एट द एंड ऑफ द सेशन. लेट्स फर्स्ट फोकस ऑन टुडेज क्वेश्चन. आज का दिन करते हैं, खत्म करते हैं, उसके बाद आपके डाउट्स लेंगे. ठीक है, चलो. सो द बज़वर्ड विद डिस्ट्रीब्यूशन एंड न्यू डिजीजेस, डिस्क्रिप्टिव स्टडी. Going to question number 4. Why is this L को mark क्यों हो रहा है? Okay, let's see if you can do this question. All right, look, all the statements are true about disease except incidence is probability that a healthy individual will develop the disease during a specified time period. Incidence will decrease if a new drug is effective in reducing deaths from the disease. Incidence measures the absolute risk of developing the disease. Incidence decreases if a particular prevention program is effective. Very good guys, that was so quick. I'm so happy. बहुत खुशी हुई, बहुत अच्छी बात है. You were very quick in answering guys. Incidence क्या होता है? Let's revise. Incidence is nothing but new cases. ठीक है, एंड विच स्टडी डिजाइन हेल्प्स यू कैलकुलेट और हेल्प्स यू एस्टिमेट द इंसिडेंस ऑफ अ डिजीज गाइज? कौन सी स्टडी डिजाइन इंसिडेंस कैलकुलेट करने में मदद करती है? वी ऑल नो इट इज अ कोहॉर्ट स्टडी, राइट? इंसिडेंस इज कोहॉर्ट स्टडी. नाउ लुक एट द फर्स्ट स्टेटमेंट. It is the probability that a healthy individual will develop disease during the specified period. Yes. Now all of us are healthy. Some of us are drinking, some of us are non-drinking. Okay. So some of us are exposed to alcohol, some of us are non-exposed. पर अभी हम में से किसी को CVD नहीं है. None of us have CVD. Then I'm going to follow up you to see how many develop CVD. So it is definitely new cases. It is definitely the probability or chance of developing a disease. So this statement is true. ठीक है? All right. Now, incidence measures the risk of developing disease. True. ठीक है? Now, incidence, new case. New case कब बनता है? When we have the risk factors. All right. So if you launch a prevention program, what is going to happen? It will target the risk factors, guys. Okay. Prevention program targets the risk factors. And जब risk factors will be targeted, then only the new cases will decrease. Are you understanding? जब risk factor को target करोगे, तभी new cases decrease होंगे. तो incidence will decrease if a particular prevention program is effective. Absolutely true. But look at option B. Incidence will decrease if a new drug is effective? No. New drug will never act on the risk factors. New drug will always act on the already existing cases. तो नया drug effective in reducing deaths. Deaths नहीं होने दे रहा. So what is it going to affect? It's going to affect the prevalence. New drug never affects the incidence. New drug will affect the prevalence. Okay, prevalence will decrease. Clear everybody? One more practice question over here I'm going to give you. Let's calculate this. Incidence of a disease in a population of 30,000 and 300 new cases is. What is the answer to this? So this time, you know what I've done in short. न्यूमेरिकल का अलग से सेशन आई हैव केप्ट, बट एवरी डे ऑल्सो आई विल गिव यू 1 or 2 न्यूमेरिकल्स एवरी डे. इवन इफ आई डोंट हैव अ न्यूमेरिकल रिलेटेड टॉपिक, मैं तुमको न्यूमेरिकल प्रैक्टिस कराऊंगी हर दिन 1 या 2 कम से कम, सो दैट यू गेट दैट कॉन्फिडेंस. ओके, दैट एग्जाम में न्यूमेरिकल आना ही आना है, नो एस्केप. Very good, guys. Now we all know what is incidence. Incidence means the total number of new cases. So 300 is the new cases, and what is the population at risk? 30,000. Now what do you multiply the incidence with? 100 या 1000. So incidence हम लोग हमेशा multiply करते हैं thousands. Incidence is actually a rate. Numerator is a part of denominator and the multiplier is 1000. Okay, so what did you get your answer as? Very good, all of you. What did you get your answer as? So over here, when you will subtract all these three, okay, it is 10 per 1000. So what is your answer? 10 per 1000. And don't worry, you have a calculator these days. Okay, you have a calculator, so it's completely fine. बस formulas memorize कर लेना है and we will be able to do the questions. Okay, next question. This was, ये कौन सा question था? I didn't mark it. What was the number of this question? One second, I'll just do marking also. This was question 4 and this was question 5. Okay, moving to question number 6. Let's see if you can do this. When a new treatment is developed that delays death but does not produce recovery from a chronic disease. ये क्या हुआ? Yeah, I got scared. Now it should not stop working. Okay. All right, chalo. When a new treatment is developed that delays death but does not produce recovery from a chronic disease, which of the following will occur? Question number 6. Question number 6. What is going to happen over here, everybody? What is going to happen over here? New treatment आया है, new treatment. Now what is it that we are going to revise from here? What is the relationship between prevalence and incidence? Prevalence is equal to I into D. This is our Fmge exam PYQ. Prevalence is equal to incidence into D. याद रख के जाना है, ठीक है? D क्या होता है guys? D is the duration of the disease. Okay. Now what is happening over here? A new treatment has come. It delays death. That means it's not letting you die. Somebody is not dying, but it's not curing it, but does not produce recovery. Does not cure. Okay, does not cure. But D क्या हो रहा है? Live longer with the disease. Okay, the person will live longer with the disease. So what is going to happen to D, guys? The D of course is going to increase. Now if duration increases, what will happen to prevalence? Prevalence will also increase. Clear everybody? ठीक है, एक नई ट्रीटमेंट आई है जो आपको ठीक नहीं कर रही, जो आपको ठीक नहीं कर रही. You are not getting better. All right, but you are living longer with the disease. Example, very good example is ART drugs. Do ART drugs cure a person? No, but a person is going to live longer with HIV. So what is going to happen? Prevalence is increasing. But क्या drug risk factor पे काम करता है? No, risk factors remain the same. Okay, risk factors remain the same. Therefore what will happen over here? New drug will never act on the risk factors, so incidence will be the same. ठीक है, incidence will be the same. Thumbs up everybody. I hope I'm not going too fast. सबको समझ आ रहा है? ठीक है, मेरा टारगेट है 1 hour से 1 hour 10 minutes. That's it. That much is sufficient for everyday practice of questions. Okay, quickly, question number 7. Improved prevention of an acute non-fatal disease is likely to, ठीक है, improved prevention of an acute non-fatal disease is likely to, ठीक है, improved prevention, क्या आंसर होगा इसका? Just a quick revision. Okay, Dr. Dreamer, just put it down. I will discuss this again. देखो guys, simple सी बात होती है, P is equal to I into D. Prevalence is existing cases, incidence into duration. Okay, now if the duration will increase, prevalence will decrease. Okay, now if I have a new drug that cures a person, then what will happen? D will decrease. So what will happen to P? P will decrease. But if I have a new drug that does not cure you but prolongs, lets you live longer, आप उससे live longer कर रहे हो, so D will increase, P will increase. But this is a drug, this will not act on the risk factor. So इस दोनों cases में क्या होगा guys? Incidence तुम्हारा same रहेगा. But यहाँ पे देखो prevention आया है, प्रिवेंटिव मोडालिटी हमेशा क्या करेगी? प्रिवेंटिव मोडालिटी विल टारगेट द रिस्क फैक्टर. ओके, प्रिवेंटिव मोडालिटी, व्हाट इज इट गोइंग टू डू? इट इज गोइंग टू टारगेट द रिस्क फैक्टर. सो व्हेन माय रिस्क फैक्टर विल बी टारगेटेड, नए केसेस नहीं बनेंगे. सो व्हाट इज गोइंग टू हैपन ओवर हियर गाइज? Incidence will decrease. Got it? So what is happening over here? Decrease the incidence of disease. Is this concept clear to everybody? This is the first part. Prevalence, old existing cases. Incidence, new cases. Okay. P is equal to I into D. Incidence, cohort study. Prevalence कौन सी स्टडी बताती है? Just for your quick revision, prevalence कौन सी स्टडी बताती है? Cross sectional study. Okay, now anybody who has not got it, don't worry, let me wrap up the questions, Shubham, and I'm going to come back and discuss this topic once again. ठीक है, एक बार ख़त्म करते हैं सारे questions, then I'm going to come back again to this and do it. All right, prevalence later part. ओके, लक्षिता हैज आस्क्ड अ वेरी गुड क्वेश्चन कि मैम प्रेवलेंस नहीं कम होगा. प्रेवलेंस कम होगा लक्षिता, बट उसमें टाइम लगेगा. ओके, इट्स गोइंग टू टेक टाइम. इमीडिएटली क्या कम होगा? इंसिडेंस. ऑब्वियसली व्हेन न्यू केसेस विल डिक्रीज, इट विल लीड टू अ डिक्रीज इन प्रेवलेंस ऑल्सो. सो विद ड्यू कोर्स प्रेवलेंस विल डिक्रीज, बट देन इट्स गोइंग टू टेक टाइम. सो माई प्रायोरिटी हियर विल बी टू मार्क ऑप्शन सी. गॉट इट लक्षिता? ठीक है, सी और ए में चॉइस सी क्यों है? क्योंकि तुरंत रिस्क फैक्टर पे केटर किया जाएगा तो न्यू केसेस खत्म होंगे, कम होने लगेंगे, तो इवेंचुअली प्रेवलेंस कम होगा, बट तुरंत क्या कम होगा? द न्यू केसेस. क्लियर? ओके, मूविंग टू क्वेश्चन नंबर 8 फॉर द डे. लेट्स सी. मोस्ट फीजिबल, yes, recording will be there, don't worry. Most feasible design to assess relationship between breast cancer and risk factor OCP can be established by. Yes, very good Yash. Agar both incidence and prevalence, then of course that will happen. Okay, but if you have to select one option Yash, first incidence घटेगी, then in due course of time prevalence घटेगी. So what is your answer over here? Most feasible design. What do you mean by feasible? You know, MCQs is also a play of English words. Okay, they play with the words. Like over here what it is saying? Feasible. Feasible means something which can easily be done. Okay, something which can easily be done. It's easy to do it. That means it's not going to be costly, it's not going to be time taking. And now I want to assess relationship between breast cancer and risk factor OCP. हमेशा I've told you guys, whenever you get a question on study designs, आपको क्या याद रखना है? You have to remember the approach. ठीक है, अप्रोच. सो द फर्स्ट थिंग दैट यू हैव टू लुक एट एक्सपोजर एंड आउटकम. व्हाट इज द एक्सपोजर ओवर हियर? OCP. और यहाँ पे मेरा आउटकम क्या है गाइज? ब्रेस्ट कैंसर. बट अगेन, व्हाट इज ब्रेस्ट कैंसर? इज इट अ वेरी कॉमन डिजीज? नो. Although breast cancer is the most common cancer in India as well as worldwide. इंडिया में भी सबसे कॉमन है, वर्ल्ड वाइड में भी. बट एट द एंड ऑफ द डे है तो कैंसर ना, है तो कैंसर. तो ब्रेस्ट कैंसर क्या है? एक रेयर डिजीज है. एंड रेयर डिजीज के लिए व्हाट इज द मोस्ट फीजिबल वे? व्हाट इज द बेस्ट स्टडी डिजाइन टू कंडक्ट? अ केस कंट्रोल स्टडी डिजाइन. क्लियर? व्हाट आई कैन डू इज आई कैन टेक द पॉपुलेशन. I can look at people, women who have breast cancer, no breast cancer, and what am I going to do? I will compare diseased, non-diseased, and I will just ask them that did you have take OCP? No OCP. ठीक है, OCP लिया? No OCP. Clear? OCP, no OCP. Everybody got it? So two buzzwords that you will remember over here. Rare disease. Rare disease के लिए preference is always a case control study design, and it's one of the feasible option. Thumbs up. Question number 8 done. Thumbs up everybody. ठीक है, very good. Dr. Puneet लिख रहा है from outcome to exposure. Exactly Puneet. That means what is it? effect to cause or is it cause to effect? Remember, one more, case control study is always effect to cause. Effect has already occurred. Effect to cause, क्योंकि this is also a PYQ. Effect to cause is which study design? Effect to cause is a case control study design. ठीक है, चलो आगे बढ़ते हैं. Question number 9 of the day. Question number 9 of the day. Very easy, but question ही disappear हो गया. बीच बीच में कुछ हो जाता है. चलो आंसर. Okay, question will come, don't worry, it just disappeared, it's going to come. Population is the unit, just wanted to revise this one step again. Population is the unit in which study design? Ecological study. ठीक है, population किस में unit है? Ecological. अब ecological का separate question भी आएगा, so you don't have to worry, just wanted to revise that one point with you. Okay, alright, moving to the next question. This was question number, that was question number 9, question number 10. Let's see. Question number 10. ठीक है, we have a lot of questions today. ठीक है, another 40 minutes with a lot of questions. चलो, a study to determine the association between smoking histories from pregnant, one second, I'll just set this, yeah, from pregnant women during the antenatal visits and then subsequently assessing the birth weight of the babies soon after delivery. ये कौन सी study design है? What type of study design is it? One second guys. Yeah, ये ना तार मेरे से हिल जाता है and it, anyways. Okay, now I wanted to discuss a few buzzwords over here. Number 1 guys, कभी भी whenever you're going to get an MCQ where you have to identify कि ये कौन सी study design है, first thing तुमको क्या पता करना है? Exposure and outcome. Now what is the exposure over here? The exposure over here is smoking. Okay, outcome over here is to look at birth weight. Okay, now I have always told you कि guys buzzwords देखो, और मैं तुमको हमेशा बोलती हूँ in offline classes as well that if you see a word history it means going back, right? History मतलब going back, but is history over here referring to going back? No, this is an exception. ठीक है, यहाँ पे history का मतलब हम पीछे नहीं जा रहे हैं study में. यहाँ पे क्या हो रहा है? You have to look at the direction. ठीक है, you have to note the direction. Okay, you have to note the direction, you have to note the comparison groups. ठीक है, direction note करोगे, comparison group note करोगे. Okay, you have to note the direction and comparison group. Now whenever my comparison group would be exposed versus non-exposed, ठीक है, कभी भी exposed versus non-exposed होगा, it is always and always a cohort study. दुनिया इधर से उधर हो जाए, whenever it is a cohort study, exposed non-exposed, prospective cohort, retrospective, कुछ भी तरीके का cohort हो, all right, it is always exposed non-exposed. And whenever you have cases and controls, diseased and non-diseased, it is case control study design. ठीक है, now let us look over here. So these 3 factors you have to keep in mind, and of course some buzzwords. So यहाँ पे I have to know the association between smoking history from pregnant women during antenatal visits. That means guys, the women have come to me during which time? The women, okay, the women have come to me during which time everybody? During pregnancy time. ठीक है, और मैं उनको क्या बोल रही हूँ? ANC visits. I am asking, did you ever smoke? Non-smoker. Okay, and look at this buzzword, subsequently assessing. That means I am going to do a follow-up to see after 9 months how many children low birth weight, how many children no low birth weight. So which type of study is it? आप कैसे जा रहे हो? You are moving from cause to effect. You are proceeding from cause to effect. It is definitely a follow-up study. So which one is it? Prospective cohort. Case control, you go backwards. Cross-sectional study में we are standing at the same point of time. ठीक है, did all of you understand this? कभी ये मत सोचना कि यार मैम ने तो बोला था history का मतलब backwards होता है guys, but यहाँ पे over here history is not backwards. He's come to me at the time She has come to me during her antenatal visits and I am taking her history. Okay, love, I'll give you the buzzwords. Okay, so the buzzword follow up. At the end, I'll sum up the buzzwords for you. Follow up, subsequently, that means cohort. Got it? चलो, moving to question number 11 of the day. सब मेरे साथ हैं, चलो आगे बढ़ते हैं. Question number 11. Let's see if you can do it. An epidemiologist, okay, I will give you all the examples, Rohit. We have a lot of questions, don't worry. सारे study design का example मिलेगा. All study design examples we will be doing. Numericals we will be solving. Epid say we are not leaving anything today, okay, in another 40 minutes, okay, don't worry. Chalo, bolo. An epidemiologist is assigned to conduct a study on 5,000 people having hyperlipidemia and those having normal lipid profile. Okay, no issues. He has to keep track of all the participants to observe the development of stroke in these patients to confirm that hyperlipidemia increases the risk of stroke. So again, अप्रोच पे चलेंगे सारे कोई. अप्रोच, व्हाट वाज द अप्रोच गाइज? एक्सपोजर बताओ, आउटकम बताओ. एक्सपोजर एंड आउटकम बताओ. एक्सपोजर क्या था गाइज? ओवर हियर वी आर टॉकिंग अबाउट लिपिड, सो एक्सपोजर इज लिपिड एंड आउटकम दैट वी आर लुकिंग एट इज स्ट्रोक. एंड ऑलवेज लुक एट द नंबर्स गाइज. There is one more hint for a cohort study guys. When we have larger sample size, it's mostly a cohort because case control में कभी इतना बड़ा sample size नहीं होता. ठीक है? So now I have to do a study on 5,000 people having hyperlipidemia and those having normal. So that means I am comparing what? Hyperlipid, okay, with what guys? Normal lipid, okay. And what am I going to do? So my comparison group is exposed, non-exposed, matlab cohort. Now I have to keep a track to observe the development of stroke. So again, that means stroke, that means it is a follow-up study, right? I have to look at stroke, no stroke. So ये कौन सी study design है? Is it a retrospective cohort? No, I am not going backwards, I am moving forward in time. Okay, why is it not a case control study? Because I am not comparing cases and controls. I am starting with exposed, non-exposed. So what is it? Prospective cohort. Got it? I will give you a question of retrospective cohort also. एक एक करके समझो, हड़बड़ाना नहीं है. चलो आगे बढ़ते हैं. Next question for the day. Question number 12. Let's see if you can do it. And anybody has any doubt, keep noting it down. ठीक है, नोट करते जाओ. I will take up all the doubts at the end of the class. Don't worry. If a researcher wants to study precedence relationship between exposure and effect, all right, which design should he prefer? Again, different way of asking. मुझे क्या करना है? Relationship between exposure and effect. And with study design do we go from exposure to outcome? That means कौन सी स्टडी डिज़ाइन में यू कंपेयर एक्सपोज्ड नॉन एक्सपोज्ड. दैट मीन्स इट्स अ सिंपल क्वेश्चन ऑफ cause to effect. So कौन सी स्टडी डिज़ाइन में यू सी प्रेसिडेंस रिलेशनशिप. प्रेसिडेंस रिलेशनशिप मतलब cause precedes effect, okay, cause precedes effect. And what else do we call this as guys? Cause precedes effect, we also call this as temporality, okay. So which study design? Obviously exposed, non-exposed, okay, and then आप forward जाओगे to look at the effect. So what is this? Cause precedes effect. So which study design everybody? Cohort. Clear? Another टेम्पोरैलिटी का मीनिंग तुमने पढ़ लिया. PYQ, cause precedes effect. Smoking leads to lung cancer. Okay, temporality means smoking leads to lung cancer. Okay, smoking leads to lung cancer. This is the meaning of temporality. पहले एक्सपोजर होगा फिर आउटकम होगा. और कौन सी स्टडी डिज़ाइन टेम्पोरैलिटी बेस्ट एस्टैब्लिश करती है? विच स्टडी डिज़ाइन कैन बेस्ट एस्टैब्लिश टेम्पोरैलिटी गाइज? सो इट इज़ नन अदर देन कोहॉर्ट स्टडी. ओके, कोहॉर्ट स्टडी बेस्ट एस्टैब्लिशेस टेम्पोरैलिटी. गॉट इट? ओके, ऑल राइट. मूविंग टू क्वेश्चन नंबर 13. लेट्स सी इफ यू कैन डू इट. Exposure to multiple outcomes. Temporality, cohort. Exposure to effect or cause to effect is again cohort, okay. Exposure to multiple outcomes. कौन सी study design? Exposure to multiple outcomes. सोच के बाबा, सोच के, कोई हड़बड़ी नहीं है. एक्सपोजर टू आउटकम 50 मिनट्स 50 क्वेश्चंस आराम से हो सकते हैं, ठीक है. एक्सपोजर टू मल्टीपल आउटकम्स, दैट मीन्स वी आर कंपेयरिंग व्हाट, एक्सपोज्ड नॉन एक्सपोज्ड. नाउ आई कैन हैव ओवर हियर मान लो अल्कोहल, नॉन अल्कोहल. ओके, नाउ आई कैन फॉलो देम अप to study about so many outcomes, multiple outcomes. CVD पढ़ सकती हूँ, कैंसर पढ़ सकती हूँ, जो भी मेरा मन करे. Exposure to multiple outcomes is with study design cohort. Okay, this is a PYQ also. Exposure to multiple outcomes. Okay, why are you writing B? B क्यों लिख रहे हो? A लिख रहे हो ना सारे कोई. Exposure to multiple outcomes, ठीक है, is a cohort study design. Okay, all right. But if I say multiple exposures, case control में आप क्या पढ़ते हो? Case control study से we study multiple exposures. Okay, in a case control you will always study multiple exposures. That means I am going to start with, okay, what am I going to start with? I am going to start with CVD, no CVD. Okay, I'll compare disease, non-disease, and then I'm going to go back and I can ask you, did you drink, did you smoke, did you eat junk food? So multiple exposures. Got it? Everybody, did you understand? Okay, chalo. So this was my question number. What was this question, everybody? This was question number 13. Moving to question number 14 of the day. Moving to question number 14. Quick look at this और फटाफट से बताओ. What type of study is Framingham Heart Study? PYQ. 10 seconds we are going to spend on this. Framingham Heart Study कौन सी स्टडी है? केस कंट्रोल है, RCT है, प्रोस्पेक्टिव कोहॉर्ट है, रेट्रोस्पेक्टिव कोहॉर्ट है, मेटा एनालिसिस है. प्रोस्पेक्टिव कोहॉर्ट. नॉट स्पेंडिंग टू मच टाइम ओवर हियर. इट इज द लार्जेस्ट प्रोस्पेक्टिव कोहॉर्ट एवर कंडक्टेड. एंड लुक एट द लोगो ऑफ दिस. इट वॉज कंडक्टेड इन फ्रैमिंगहम विच इज अ स्मॉल टाउन इन मैसेच्यूसेट्स, USA. उतना डिटेल नहीं चाहिए, लोगो देख लो, ठीक है. So this is Framingham Heart Study. All right, question number 13. All right, moving to question number 14 of the day. Let's see if you can do it. Question number 14. A study is being conducted to find out the association between aniline dye exposure and bladder cancer among workers who have worked in the factory for more than 20 years. ठीक है. For the study purpose, two groups were formed. One group directly handling dyes and the other group involving office workers not directly exposed to dyes. Now this question I keep giving you every time. Q, because I want you to identify the difference between prospective cohort, रेट्रोस्पेक्टिव कोहॉर्ट एंड अ केस कंट्रोल स्टडी. ठीक है, इसके बीच हमें डिफरेंस आना चाहिए. अब देखो गाइस, अगेन लेट्स फॉलो द अप्रोच. ओके, लेट्स फॉलो द अप्रोच. अप्रोच में आई हैव ऑलवेज टोल्ड यू, ध्यान से सुनना इसको, ठीक है. 1 minute टाइम, लिसन टू इट वेरी केयरफुली एवरीबडी, ठीक है, नो रश. Whenever you will get an MCQ where you have to identify the study design, क्या फिगर आउट करोगे? एक्सपोजर. एंड क्या फिगर आउट करोगे? आउटकम. सबसे पहले, सो व्हाट इज द एक्सपोजर ओवर हियर? डाई. ठीक है. एंड व्हाट इज द आउटकम ओवर हियर गाइज? द आउटकम ओवर हियर इज अबाउट कैंसर. ओके, ब्लैडर कैंसर, ये आउटकम है. Then you will look at the direction. Now for the direction guys, ठीक है, for the direction, all right, for the direction you have to look at some buzzwords. ठीक है, direction, कोई buzzword आपको यहाँ पे दिख रहा है? Any buzzword? Yes. Year of occupation were collected by examining past records. So past records means we are going what guys? Backwards, retrospectively. Now when we go backwards, you can have a case control, you can have a retrospective cohort. So next thing, what you have to compare? You have to compare the comparison group. Okay, यहाँ पे comparison group क्या है? देखो, for the study purpose, two groups are formed. One group directly handling dyes and the other group office workers not exposed to dyes. That means what am I comparing over here guys? Exposed, non-exposed. Dye makers, okay, क्या compare कर रहे हैं हम लोग? जो dye बना रहे हैं and जो office staff है. Are you understanding? So but the data has been collected by going backwards. So we go backwards and we compare exposed, non-exposed. So what is it? A retrospective cohort. Is it clear everybody? अब ये केस कंट्रोल क्यों नहीं है? इट इज नॉट अ केस कंट्रोल बिकॉज केस कंट्रोल में हम लोग कैसे स्टार्ट करते? आई वुड हैव स्टार्टेड विद ब्लैडर कैंसर, नो कैंसर, एंड आई वुड हैव गॉन बैक एंड आस्क्ड कि ओके क्या तुम डाई बनाते थे और वर यू वर्किंग इन द ऑफिस? डिड यू ऑल अंडरस्टैंड? एवरीबडी, डिड यू ऑल अंडरस्टैंड? ठीक है, केस कंट्रोल में तुम्हारा कंपैरिजन ग्रुप क्या होता? केसेस एंड कंट्रोल. इन रेट्रोस्पेक्टिव कोहॉर्ट यू आर गोइंग बैक एंड कंपेयरिंग exposed and non-exposed. Okay, I will quickly show you one of the image also. I think I don't have that image today, but did you understand this question, everybody? Okay, if you look at my LRR, there is also an image jahan pe we have done this question, this thing. Bas ध्यान से सुनो, look at me everyone, listen. Question आया, exposure outcome, direction. Now here there was a buzzword. You are going backwards. Now if you go backwards, and it can be case control, it can be cohort. Case control में you would have started with bladder cancer, no cancer. In a cohort, in a retrospective cohort like here, we have gone back and we are comparing exposed and non-exposed. तो कभी भी जब exposed non-exposed compare करोगे, it is always cohort. Now यहाँ we have gone back, so it is a retrospective cohort. Done? Can I go to the next question of the day? Question number 15. Quickly. In a study of the cause of lung cancer, patients who had the disease were matched with controls by age, sex, place and social class. The frequency of cigarette smoking was then compared on the two groups of with and without lung cancer. Which type of study design is it? Think carefully. Think carefully. Think carefully. Khushid, I will take up all those doubts. Okay, just let me wrap up, then I will take it up. Okay. Now guys, बस एक buzzword देना था, एक buzzword. Comparison group क्या दिख रहा है? Comparison group. It's so beautifully written, guys. Two groups with and without lung cancer. What are you comparing? The frequency of cigarette smoking was then compared on the two groups. So you have a study where you are starting with people who have lung cancer, no lung cancer, and then what is that? What is it that you are asking? Cigarette smoking. तो आप कैसे जा रहे हो? Smoke, no smoke. So आप कैसे जा रहे हो guys? You are moving backwards. So which type of study is it? Case control. And the buzzword here, circle that, matching. I've taught you many times. Matching किस स्टडी डिजाइन में की जाती है? मैचिंग इज ऑलवेज एंड ऑलवेज डन in a case control study. Very good Ginny. Matching is the buzzword. And matching क्या eliminate करता है? Matching eliminates only the known confounders. Okay, matching eliminates only the known confounders. Clear? ठीक है everybody? Question भी clear था. We were comparing two groups, smokers, people with lung cancer, no lung cancer, and asking them about cigarette smoking. So case control हो गया, plus buzzword कोई नहीं भूलेगा, matching is case control. मतलब आंख बंद करके भी मार्क कर लेना, मैचिंग केस कंट्रोल. मतलब डोंट लिटरली क्लोज योर आइज, बट मैचिंग, इफ आई वेक यू अप एट 2 o'clock एंड एट नाइट एंड आस्क यू लिसन, मैचिंग इज डन फॉर विच स्टडी डिजाइन? मैम, केस कंट्रोल. ठीक है, आगे बढ़े एवरीबडी. Okay, all right. Case series is a descriptive study design. Okay, it's just a collection of case reports. Okay, चलो moving to question number 16. I'm telling you, keep noting your doubts. ठीक है, मैं तुम्हारे doubts लूँगी, don't worry. Okay, let's quickly do question number 16. An investigator suspects that acetaminophen use during the first trimester of pregnancy can cause NTD. She estimates the risk of NTD in the general population as 1:1000. Which of the following is the best study designed to investigate the hypothesis? Just wanted to discuss one buzzword over here. सोच के आंसर करो. It's not difficult. थिंक. आपको क्या पढ़ना है? अगेन फिगर आउट एक्सपोजर क्या होगा, आउटकम क्या होगा. व्हाट इज गोइंग टू बी योर एक्सपोजर ओवर हियर एंड व्हाट इज गोइंग टू बी योर आउटकम ओवर हियर. योर एक्सपोजर ओवर हियर इज acetaminophen and your outcome is NTD. Now guys, neural tube defect, is it a very common occurrence? No. If I survey 10 houses in my society, I might not find any child with NTD. So NTD again is a rare outcome. Okay, NTD again is a rare outcome or a rare disease. So what is the best study design? I am straight away going to pick up children who have NTD, who don't have NTD, and I'm going to go back and I'm going to ask their mothers that did you ever eat this drug called aceta? No aceta. Okay, so here your buzzword was rare outcome, लिखा हुआ था 1 in 1,000 population. So what is the best study design that you will do over here? Case control study design. Clear everybody? मतलब इतने सारे example क्यों दे रही हूँ? So that you know, you when the question flashes, you remember these things. Okay, that NTD is a rare outcome. So what we should do? Always start with the disease. So it is what? A case control study design. Okay. Alright, this was question 16. Let's have question 17 on the floor. Question 17 is a PYQ. Let's see if you can do it. FMG exam का PYQ है. A researcher wants to study relation of depression with history of social media. One group had social media users with depression and the other group had social media users without depression. So what is it? Now Dr. Gurveet, देखो last question में we wanted to study NTD. Okay, and NTD is a rare outcome, no Gurveet? So what is the best thing you can do? You just pick up children जिनको NTD है and जिनको नहीं है and just go back and ask their mothers that during pregnancy did they have acetaminophen or not. Okay, alright. Now what is the exposure over here? The exposure over here is social media use. Okay, and what is the outcome? Depression. Now I told you always look at the comparison group. Okay, and any buzzword. Now this is history buzzword. Okay, this is the buzzword history. History means we will go backwards. Now when we go backwards, you have to look at your comparison group. क्या तुम्हारा comparison group exposed non exposed है या diseased non diseased है? Comparison group यहाँ पे क्या है? देखो, one group had social media users with depression. That means your comparison group is depressed and another group is non-depressed. And what am I looking at? I am going back and asking about social media use किया, no social media. Okay, social media use किया, no social media. So what was it? Case control. Also guys, depression is not a common occurrence. सारे कोई बोलते हैं we are depressed. But are we clinically diagnosed? No. So it's a very hard term guys. It's a very tough term. Okay. Anybody who's clinically depressed is actually depressed. Okay. We should not take this term very lightly. Okay. Alright. So comparison tha depressed, non-depressed, case control study design. Got it? And look at this buzzword history. Okay. Chalo, let's do some more questions everybody. Let's do question number 18 for the day. Alright. Let's see if you can do this one. 20 more minutes to go, 20-25. I'll keep updating so that you can plan your day accordingly. Okay? A study was done in 3 states to see the mean blood pressure in each community. Health workers were assigned and they visited each house in the 3 communities. Mean blood pressure in each community was found and compared. What type of study design is it? Now, can anyone tell me what is happening over here? Ab dekho guys. Is it a cohort? No. It's not a cohort. You are not going forward. Okay, the study, the mean blood pressure is being taken at the same point of time. It's not a case control. You are not going backward. दूसरी बात guys, इसमें I am comparing 3 different states. State 1, State 2, State 3 at the same point of time. Okay, at the same point of time. Okay, at the same point of time. कभी भी guys, if you have a cohort, no, you won't have 3 different groups. In a cohort, one group you will divide into exposed, non-exposed. For a case control, one group you will divide into diseased, non-diseased. समझ रहे हो? यहाँ पे what is happening? 3 states है. Okay, and my health workers have visited each house in the 3 communities. So there is team 1, there is team 2, there is team 3. And what are we doing? We are comparing mean blood pressure in each of the 3 states. So it is done at the same point of time. So which study is this? Cross-sectional study. Also, very good gimme. We rely on which data for cross-sectional study? We rely on primary data. Primary data means researcher collects the data himself. Okay, we rely on primary data. It's a snapshot of the population. Clear? Cross sectional study क्या calculate करके देता है? Very very important, prevalence. Okay, it helps you calculate prevalence. Clear? Same point of time, cross sectional, ecological. Cross sectional primary data, ecological relies on secondary data. ठीक है? Anybody has any doubt? इसको लिख लो. चलो, let's see if you can do this one. Question number 19. Question number 19. Read it. अब तुम ऐसा सोचो, question 19 has flashed in front of you on the computer screen. Okay, you have with you 1 minute to answer. Mark. Now, what is the buzzword over here? Very good, guys. What is the buzzword? Field trial aman vaccine trials होते हैं, ठीक है? Field trials are vaccine trials. Okay. Now, what is the buzzword over here? बहुत ज़रूरी word, correlation. Correlation is demonstrated by which statistical diagram? Who remembers it? Correlation is demonstrated by which statistical diagram? किसको याद है? याद है ये वाला नाम? Scatter diagram. Biostats भी revise होगा, don't worry. Correlation is denoted by scatter diagram. Okay, and correlation is the word which is denoting what? Ecological study. Okay, correlation was a buzzword. Plus, he did this by collecting data from food manufacturers and hospitals respectively. So, we are relying on which data, guys? We are relying on secondary data. So, which type of study it is? Ecological study design. Cross-sectional nahi hai because it would have relied on primary data. Experimental nahi hai, there is no intervention. I am just looking at observations. Okay, I am just looking at relation between fatty food intake and disease due to obesity. Psychological study always deals with psychological factors. Clear? Everybody, did you understand this? Okay, all right, let me show you one more question. You remember this image? सबको याद है ना? This is an image of scatter diagram and this has been discussed in LRRs, this has been discussed in rapid revision, prep ladder, everywhere. ठीक है? Scatter diagram, correlation. और ये देखो unit of study क्या थे? Countries. तो जब countries पढ़ोगे ये कौन सी study design है? Ecological. Okay, when the unit of study is countries, population, it is ecological study design. Okay. This was a scatter diagram. Okay, so we are done with question number 19. Chalo, question number 20. Let's see if you can do it. A person wants to study about relationship between smoking and lung cancer. So he collects data about people diseased with lung cancer from government hospitals and number of cigarette packets sold at the same time period. देखो different ways में तुम्हें question दिखा रही हूँ. इसका आंसर क्या है? Same time period. Okay, same point of time. Remember, same point of time could be cross sectional, same point of time could be ecological, but when I have primary data, okay, it is cross sectional. When I have secondary data, it is with study design, ecological. So here I have collected data from government hospitals. So that means I am relying on which data, guys? I am relying on secondary data. तो आंसर क्या हो गया everybody? Ecological. ठीक है, different wordings के लिए, different study designs के लिए we are looking at the examples. Okay, now question number 21. Let's see if you can do this one. Question number 21. A research group designed a study to investigate the epidemiology of syphilis. The investigators examined per capita income rates and rate of syphilis in Delhi, Hyderabad, Noida, Mumbai. Data on city-wide syphilis rate was provided by each city's health agency. देखो different fashions में, मतलब I have left no scope. Different ways in which you can get a question. क्या पढ़ रहे हो यहाँ? Cities. Cities क्या होता है? Individuals या population? सिटीज़ क्या होता है? सिटीज़ क्या होता है? सिटी इज़ अ पॉपुलेशन. एंड कौन सी स्टडी डिज़ाइन में यूनिट ऑफ स्टडी इज पॉपुलेशन? एवरीबडी, इकोलॉजिकल. ऑल्सो वी वर कलेक्टिंग द डेटा फ्रॉम व्हाट? ईच सिटीज़ हेल्थ एजेंसी. सो ये कौन सा डेटा है? दिस इज विच डेटा? दिस इज सेकेंडरी डेटा. Clear everybody? So what is the type of study design that we are looking over here? This is a ecological study design. Okay, so all the study designs we have seen. Now let us look at some other MCQs also. Chalo, let us see if you can do this one. In a prospective study, 1500 patients were randomly selected to study the effect of a new drug. The drug will be given for 5 years and its association with diabetes will be studied. What type of study is it? Case control, cohort, RCT, cross sectional. अब ये मत सोचना कि यार मैम ने तो लिख दिया है prospective तो cohort नहीं. Which other study design is prospective in nature, guys? Which other study design is prospective in nature? Which will always be prospective? The effect, to study the effect of a drug. So here there is a new drug. This is what? This is an intervention. This is an experiment. In सब में तो हम observe करते हैं. Case control, cohort, cross sectional. We were just observing. RCTC is the first one where we have done an intervention. Clear? Okay. This was question number. I always forget. You have to remind me that ma'am it's question 22 because I want you to mark yourselves. But उस number से घबराना नहीं है चाहे कितने भी number आए, ठीक है? Question number 22 done. All right. Okay. Let's do question number 23. Then we'll go to some numericals. Let's see if you can do this. A little tricky one, but I want to give you one buzzword. बताओ. A public health physician wants to study the load of hypertension in Ghaziabad district to establish special screening and treatment services. Okay, in the mention, which study design is most useful for this? Which study design is most useful for this? अब मान लो मुझे गाजियाबाद डिस्ट्रिक्ट में I want to see the load of hypertension. So if I ask you, listen, let's stop the class for now and go outside and look at the load of hypertension in the community, guys. तो तुम क्या निकालोगे? Hypertension in the community. ठीक है, तो आप क्या निकालोगे? All right, load. Very good. Load means the burden of a disease. Okay, burden of a disease. And whenever you have to assess the burden of a disease, what should you do? You should go and calculate what? You should go and calculate the prevalence. और prevalence को calculate करने के लिए एक ही study design है, cross sectional. I will go outside and ask. I will look at all the houses. If there are 100 houses, 5 houses tell me that I have hypertension, that people in the houses. So 5 by 100 into 100, 5%. And whenever, this was also your buzzword, screening will be covered tomorrow. Whenever the burden is more of any disease, then we establish screening tests. Clear? Everybody, can I go to the next question, everyone? Okay, chalo. So question number 24. Let's see if you can do this. A researcher wants to study natural history of silicosis in a population of industrial workers. Which design is more useful? बताओ इसका आंसर बताओ. 2 buzzword देना था. Basically my purpose of this question was to give you a buzzword here. The purpose was to give you a buzzword. Now see, exams are very near. Okay, we can't go into too much detailing, but look at this, natural history. What is natural history? How a disease evolves in the absence of an intervention. So I am working silicosis का एक exposure बताओ. Sandstone industry. So I am working in a sandstone industry. Somebody is not working there. Okay, so to study exposed, non-exposed. All right, if I don't do any intervention, no checkups in between, how the disease will occur. So exposed, non-exposed. Natural history को पढ़ने के लिए best study design क्या है? Cohort. Temporality को establish करने के लिए best study design क्या है? Cohort. And what is the other term for a cohort? Longitudinal study. Longitudinal study is synonymous with the prospective cohort study. ठीक है, longitudinal study is a synonymous with the prospective cohort. Now the medicine is asking something very good. Silicosis is rare. बच्चे, silicosis is not rare in the sense occupational disease है. Occupational disease को पढ़ने के लिए the best thing is exposure. It's an exposure, rare exposure. And natural history पढ़ने के लिए I can't start with people who have the disease. I will have to see how the disease occurs. And which study design helps you to see how the disease occurs? Of course, it's a cohort study. जो लोग सिलिकोसिस या उस इंडस्ट्री में काम कर रहे हैं और जो लोग नहीं काम कर रहे हैं उनमें कैसे सिलिकोसिस occur करता है. Are you understanding? Very good. Aisha, did you understand? And somebody else also asked you. It's not about a rare disease question here. It's about natural history in a population. And don't get confused कि population बोल रहा है. What I want you to know, one more thing. Occupational exposures के लिए which is the best study design? cohort study. Okay, rare exposure. It's a rare exposure. Rare exposure के लिए you have cohort study. ठीक है, everyone, did you understand? Rare exposure के लिए cohort है. Rare disease के लिए case control है. Natural history and temporality, it is cohort. Okay, all right. Chalo, let's do question number 25 now. Let's do a few numericals. Okay. All right. Anybody who didn't, just note it down. Question number note karo and then I will discuss it. In a cohort study conducted, out of those, ठीक है, exposed to risk factor, 10 are diseased, and out of those non-exposed, only 5 are diseased. What is relative risk? Don't worry, Sneh. What I will do is, let me finish the questions. At the end, I always give you a buzzword slide, okay? कि कौन सी disease होगी तो क्या mark करोगी, कौन से word होंगे तो कौन सी study design होगी, अभी करेंगे, ठीक है? घबराने का नहीं है, don't worry at all. Now, what is the formula for relative risk? How many remember the formula for relative risk? It is calculated in a cohort study. Incidence among exposed divided by incidence among non-exposed, right? Non-exposed. Now over here guys, out of those exposed to risk factor, how many are diseased? 10. Out of those non-exposed to risk factor, how many are diseased? 5. So what is the relative risk? 2. How many of you got this? Relative risk kitna hai? 2. Simple question. This was a NEET PG PYQ. Okay, this was a NEET PG PYQ. Now you all know what is the interpretation of relative risk, everybody. If relative risk ever comes more than 1, it is a risk factor. Okay, if relative risk comes equal to 1, it has no association. Okay, no association. And if it comes less than 1, what is it guys? It is a negative association or a protective factor. This thing you can expect. All right, okay. जैसे मान लो relationship between diabetes and herbal tea, 0.8. 0.8 क्या हो गया? Protective factor. Okay, all right. One more question. False about odds ratio is. Now I wanted to discuss relative risk cohort study. Case control study में क्या calculate होता है? Everybody, case control study में what is it that you calculate? You always calculate odds ratio. ठीक है? So what is the answer to this? False. Odds ratio equal to 1 mean no association. Correct. It can be 0.3. Correct. It can be 3. Correct. Is it always more than 1? No, it is not always more than 1. Odds ratio could be more than 1. Odds ratio could be equal to 1. And odds ratio could also be less than 1. Okay, is it clear everyone? Okay, it can also be less than 1. Now, what was the formula for odds ratio? Kisko yaad hai? I think I have a numerical also for odds ratio. Let me give you that numerical quickly. Okay, take up this one. Question number 26. I want you to quickly calculate the odds ratio here. Calculate the odds ratio. Oh, तुम्हें दिख ही नहीं रहा होगा ना? अभी दिखेगा. This value is 30 guys. Okay, this value is 30. So can you tell me what is odds ratio? Everybody, can you calculate odds ratio? This is A, this is B, this is C, this is D. What was the this thing? I've always told you. आउटकम कॉलम साइड में होगा, एक्सपोजर रो साइड में होगा, A, B, C, D. So what is odds ratio? Odds ratio is a cross product ratio. So it is what? AD upon BC. Okay, AD upon BC. Easy. 30 into 30 upon 20 into 20. So what is this? 9 by 4. So what is it? 2.25. Clear? AD upon BC. Clear? Odds ratio revision done. Odds ratio is also known as cross product ratio. Okay, odds ratio is also known as cross product ratio. Clear? Okay. One more numerical I wanted to give you. All right. Okay. Wait. Before that, one question. All are disadvantages of cohort study except, what is the answer? Attrition bias, recall bias. Cohort studies are expensive. Cohort studies involve a large number of subjects. क्या है इसका आंसर? All are disadvantages. Disadvantages of cohort study. 1:5 अमन मतलब 1:5. 1:5 मतलब 1/5, that is 0.2, which is less than 1. Okay, so it's a protective factor. ओके, वेरी गुड. रिकॉल बायस किसका होता है? केस कंट्रोल. ठीक है, केस कंट्रोल. अट्रिशन बायस क्या होता है? लॉस टू फॉलो अप. लॉस टू फॉलो अप इज अ प्रॉब्लम ऑफ कोहॉर्ट स्टडी. व्हाट इज द अदर बायस दैट यू सी इन अ कोहॉर्ट स्टडी गाइज, व्हिच कम्स इन आवर एफएमजी एग्जाम्स, नीट पीजी ऑल्सो? हॉथरॉन बायस. ठीक है, हॉथरॉन बायस. Hawthorne bias is also seen in a cohort study. What was it? Subjects modify their behavior on being observed. Okay, if you are a smoker, you quit smoking in between. Okay, so that is Hawthorne bias. Clear? All right, moving to one more MCQ for the day. Let's see if you can do this. No, let's do this one first. Okay, an epidemiologist, question number 27. An epidemiologist wants to know about the risk of developing pulmonary embolism in users of OCP as per information given below. Calculate the relative risk. Anybody? Take your time. बस रिवाइज करना था गाइज. ठीक है, यहाँ पे क्या है? पल्मनरी एम्बोलिज्म. पल्मनरी एम्बोलिज्म. नाउ यू कैन गेट अ क्वेश्चन लाइक दिस. अगेन ऑल आई वांट यू टू डू इज ABCD. हमेशा डायरेक्शन ABCD ऐसे. नाउ व्हाट इज रिलेटिव रिस्क गाइज? It is incidence among exposed. Okay, incidence among exposed divided by incidence among non-exposed. ठीक है, incidence among non-exposed. Now guys, many of you are getting confused. LRR या ये session guys, ये session ना तुम्हारा daily practice है. तुम टच से नहीं जाओगे. ऑल राइट, 1 hour, दैट्स इट. ओके, सो इट विल गिव यू दैट एक्स्ट्रा कॉन्फिडेंस एंड यू आर रिवाइजिंग ऑल्सो. वी आर नॉट डूइंग थियोरी, वी आर डूइंग क्वेश्चंस. डोंट कंपेयर. टाइम में बैठो, क्वेश्चन लगाओ, कुछ और पढ़ने चले जाओ. यू अंडरस्टैंडिंग? सो डोंट वरी अबाउट इट. वी आर नॉट डूइंग नोट्स हियर, वी आर डूइंग क्वेश्चंस हियर, which makes a lot of difference. Okay, all right, ABCD. So what is the incidence among exposed? So over here guys, how many are exposed? कितने लोग OCP ले रहे हैं? A+B. Okay, so that is A+B. Out of them, how many suffered A? All right. How many are non-exposed? C+D. How much out of that? How many suffered pulmonary embolism? C. So 120 plus 80 by 120, and over here again 80. उसमें से कितनों को pulmonary embolism हो गया? 20. So 120 upon 200 by 10 upon 80. Yes, everybody, were you able to solve this? So what is your answer over here? Everyone got it? Okay, so what is your answer? 4.84. So that means relative risk is more than 1. Clear? Okay, all you need to know is incidence among exposed divided by incidence among non-exposed. Okay, how many are exposed is A+B. उसमें से कितनों को embolism हुआ? A. How many are non-exposed? C+D. उसमें से कितनों को embolism हुआ? C. Okay, all right. One more thing that you should remember is, what is the formula for attributable risk? I wanted to discuss that, but I've lost that question. Okay, what? Yeah, this one. Tell me quickly. Several studies, question number 28, 10 more minutes to go. Several studies have shown, ठीक है, several studies have shown that 85% of cases of lung cancer are due to cigarette smoking. It is a measure of. Calculator आजकल मिलता है, नहीं भी मिले तो भी क्वेश्चन लगाना है, नहीं मिला तो भी क्वेश्चन लगाना है ना, करना तो है. You can't leave it. Keep revising the formulas, keep practicing with me, you will be able to do it. ठीक है, चलो ये क्या है? एट्रीब्यूटेबल रिस्क. एट्रीब्यूटेबल रिस्क का फॉर्मूला प्लीज रिवाइज एंड गो. इंसिडेंस अमंग एक्सपोज्ड माइनस इंसिडेंस अमंग नॉन एक्सपोज्ड. ओके, डिवाइडेड बाय व्हाट? डिवाइडेड बाय incidence among exposed. All right, and we have to always multiply it with 100. ठीक है, all right. Incidence exposed minus non exposed divided by incidence among exposed. So that is what is attributable risk. Okay, all right. One more a few more questions guys. Tell me the answer to this. What is evidence based medicine? Can anyone tell me? Evidence based medicine क्या है? Okay, I'll tell you PAR. PAR is not that important, but मैं अभी बता दूंगी, ठीक है? I'll tell you. Dr. Panda, just remember, I'll tell you PAR. Don't worry. What is evidence-based medicine? Yes, there will be a formula-based sessions. Look at the roster. It's someday in between. So you'll get all the formula in the PDF when we have that session. Okay? So what is the answer to this, everybody? Evidence-based medicines means with study designs provide us the maximum evidence. Okay, so is it clinical trials? No, it is use of various research findings for taking decisions which is best about patient care. Not all of the above. Research findings use करना है decision लेने के लिए which is best on patient care. Father of EBM is David Sackett. Okay, father of EBM, everybody, is David Sackett. Okay, father of EBM is David Sackett. Clear? Father of EBM is David Sackett. All right. Now, one more question over here. Can you answer this? Systematic error in determination of association between exposure and disease is termed as. What is the answer over here? Systematic error. So the buzzword is systematic error. Systematic error kya tha? Systematic error, very good. Systematic error is always known as bias. How do you eliminate bias? Bias is eliminated by what is known as blinding. Okay, which form of blinding is the best one? Triple blinding. Okay, which form of blinding is the best one? Triple blinding. But which is the most common form of blinding, guys? Double blinding. But सबसे अच्छा blinding क्या होता है? Triple blinding. Subject, investigator and analyzer, सारे कोई को पता ही नहीं है कौन किस में जा रहा है, ठीक है? Not this one. Let's do this one. Recall bias is most commonly associated with question number 29. Recall bias किससे associated है? बताओ फटाफट से आंसर दो. Recall bias, we've done this. Case control. Okay. Recall bias is case control. Okay. 30. Question number 30. Double blind means. What is double blind? Please note down your doubts because in 10 minutes we'll be wrapping up this session. So any doubt that you have in Epid, I'll take up. Okay. What is the answer to this? Double blind means observer is blind. Person or group being observed is blind. Observer तो सिर्फ investigator होता है, ठीक है? Person और group being observed तो सिर्फ subject होता है. Okay, both observer and observed group. Okay, this observer is investigator. All right, and who is the observed? Observed group is the subject. Okay, so just read these few points. It will help you in revision. Okay, one more question I wanted to discuss is confounder. Can you tell me the answer to this? Confounding is removed by all except matching, randomization, restriction, blinding. Confounding क्या था? वो factor which is associated with exposure also, outcome also. Yes, and is an independent risk factor for the outcome. So please remember what is the answer over here. Why are you writing A? Matching eliminates known confounders. ठीक है, matching eliminates known confounders. Randomization eliminates both known and unknown confounders. ठीक है, blinding eliminates bias. Blinding क्या eliminate करता है guys? Bias. Okay, blinding eliminates bias. Now in the PDF I have given you this, in which you can see the names of the various techniques to eliminate confounders. नाम देख लेना, matching, restriction, randomization, stratification, standardization, regression. Blinding controls bias. डिटेल में करने की ज़रूरत नहीं है, सिर्फ नाम पता होना चाहिए अभी के लिए, ठीक है? चलो, one more question I wanted to discuss. Okay, all these are not that important for us, but one which is a very important question has disappeared. Okay, one second, let me go to that question. Okay, what is the answer to this? A statistical procedure by which study populations are allocated into study and control groups is called. What is the answer to that? Let me look for that question because okay, what is the answer to this, everybody? What is the answer to this? The answer to this, of course, is question number 30. The answer to this is randomization. Okay, what is the answer to this? randomization, not stratified sampling, randomization. And random means equal and known chance. Random means every participant gets an equal and known chance of being allocated into either of the group. Okay, this is what this is. Randomization means every participant gets an equal and known chance of being allocated. Okay, so RCT is like, it's a basic design. Okay, crossover trial क्या होता है? Where are the crossover trial क्या होता है? See, in RCT you have patients, you've divided them into two groups and you're following them. Alright, but in crossover trial what happens? They get interchanged. The new drug will start getting placebo and placebo will start getting the new drug. Okay, that is what is crossover trial. Okay, alright, one more question that I wanted to ask over here. I don't have it here, so you're going to tell me. The question is, everybody, one second. Which study design best establishes causality? What is your answer? Option A, RCT. Option 2, cohort. Option 3, case control. Option D, ecological. क्या मार्क करोगे इसमें? कॉजालिटी. कॉजालिटी के लिए गाइज आई एम टॉकिंग अबाउट कॉजालिटी. आई एम नॉट आस्किंग एक्सपोजर एंड आउटकम. ओके, आई एम टॉकिंग अबाउट कॉजालिटी. Okay, now when you talk about causality over here, you have to follow the evidence-based pyramid. You have to follow the evidence-based pyramid. Okay, what is the lowest study? Case report. उसके बाद क्या होता है? Case series. Okay, उसके बाद क्या होता है? All the analytical study designs. Ecological. उसके बाद क्या होता है? Cross sectional. Okay, after that what do you have? You have case control, you have cohort. Which one? Prospective cohort. Okay, then you have which one? Cohort. Which one? Retrospective cohort. Okay, retrospective cohort. Then you have RCT. Then you have systematic review, meta-analysis. Meta-analysis is the gold standard of evidence-based medicine. So over here, सबसे ऊपर pyramid में क्या है? Over here it is RCT. When I use the term causality, you have to look at this evidence-based pyramid. But if I asked you best study design to demonstrate an association between exposure and outcome, best study design. Okay, best study design to demonstrate association. Okay, association, ठीक है, between exposure and outcome. Exposure, cohort causality नहीं, exposure and outcome के लिए. Exposure and outcome, तब क्या है? Cohort. Clear? Everybody, otherwise you will follow the EBM. Alright, now two images I wanted to discuss, which I'll take up in image based session also. I hope all of you remember. ये कौन सा image था guys? This was the funnel plot. And funnel plot हम लोग किस में draw करते हैं? Systematic review and meta analysis both, to check for publication bias. Okay, to check for publication bias. And one image that you were drawing in only in something like this. Okay, at the end you have a diamond. This was what? Forest plot. Forest plot is only and only drawn for a meta analysis. Clear? ठीक है. सिलेक्शन बायस, इंटरव्यूअर बायस, ये सब के स्टडी डिजाइन में आता है. सिलेक्शन बायस हो गया, इंटरव्यूअर बायस हो गया. ओके, ऑल दिस इज सीन इन अ केस कंट्रोल स्टडी. ओके, now I am going to take up your doubts, but before that I want to discuss. Yeah, look at this. This is what? Forest plot. Okay, this is forest plot, and this one everybody is funnel plot. Okay, this one is funnel plot. Okay, just want to fill one table, but I think okay. So now I'm going to take up your doubts, and I am also going to ask you some pretty quick one-liners. ठीक है? Okay, one-liner session. चलो. The first question, okay, the first question, alright, the first question. If you get the buzzword burden, कौन सी स्टडी डिज़ाइन है? अगर buzzword burden मिलेगा, कौन सी स्टडी डिज़ाइन है? burden मिलेगा. Which study design? If you get the buzzword burden, burden का मतलब which study design? Keep answering quickly. Burden of a disease, that means cross sectional. Very good. If you see the word, okay, if you see the word where we are having matching. Matching means case control. Okay, matching means case control. If you see the word distribution, distribution का मतलब क्या होता है? Descriptive. If you get a rare disease, बस सुनते जाओ, rare disease, rare disease के लिए हमेशा कौन सी स्टडी डिजाइन? केस कंट्रोल. If you get rare outcome, ओके, सॉरी, रेयर एक्सपोजर. रेयर एक्सपोजर का मतलब हो गया, ऑलराइट, ऑलराइट, रेयर एक्सपोजर मतलब क्या हो गया? ऑक्यूपेशनल एक्सपोजर. ओके, ऑक्यूपेशनल एक्सपोजर. व्हाट इज दिस? कोहॉर्ट. नेक्स्ट, मल्टीपल आउटकम्स. मल्टीपल आउटकम्स कौन सी स्टडी डिजाइन? ठीक है, मल्टीपल आउटकम्स पढ़ने के लिए कोहॉर्ट. पॉइंट नंबर 7, मल्टीपल एक्सपोजर. मल्टीपल एक्सपोजर पढ़ने के लिए कौन सी स्टडी डिजाइन? केस कंट्रोल. ठीक है. पॉइंट नंबर 8, अगर बजवर्ड दिखा फॉलो अप, सबसीक्वेंट. ओके, सबसीक्वेंट मतलब क्या है? कोहॉर्ट. अगर बजवर्ड दिखा हिस्ट्री, हिस्ट्री बैकवर्ड्स मतलब क्या है? रेट्रोस्पेक्टिव स्टडी. रेट्रोस्पेक्टिव में इफ यू हैव डिजीज नॉन डिजीज्ड, केस कंट्रोल. इफ यू हैव एक्सपोज्ड नॉन एक्सपोज्ड, कोहॉर्ट. ओके, लास्ट पॉइंट, जब भी एक्सपोज्ड वर्सेस नॉन एक्सपोज्ड होगा, विच स्टडी डिजाइन आर वी टॉकिंग अबाउट गाइस? कोहॉर्ट. जब भी डिजीज्ड वर्सेस नॉन डिजीज्ड होगा, विच स्टडी डिजाइन आर वी टॉकिंग अबाउट? Case control. Am I clear, everybody? Okay. All right. So did you enjoy this session, guys? चलो now quickly 5 minutes to take up your doubts. Okay. समझ में आया? That's how the sessions will be continuing, guys. Tomorrow we'll have shorter class because Epid खुद में बहुत बड़ा है. So we've kind of wrapped it up in 1 hour 10-15 minutes. So I just want you to प्राइमरी एंड सेकेंडरी ऐसा कैसे पहचानेंगे? ओके, 1 सेकेंड, एक एक करके गाइस, एक एक करके क्वेश्चंस लेंगे. यू कैन स्कोर योर सेल्फ ऑल्सो. व्हाट वाज क्वेश्चन नंबर? समबडी इज आस्किंग क्वेश्चन नंबर 7. ठीक है, मेरे लिए डाउट्स लेना इंपॉर्टेंट है. ये क्वेश्चन नंबर 7, इम्प्रूव्ड प्रिवेंशन. ठीक है, improved prevention. When you talk about a preventive modality, it is going to target on the risk factors. ठीक है, जैसे स्मोकिंग सेसेशन पॉलिसी लोगों को स्मोक करने से रोकेगा तो नए केसेस कम होंगे. आर यू अंडरस्टैंडिंग? न्यू केसेस विल गेट रिड्यूस्ड इन ड्यू केस ऑफ टाइम, कोर्स ऑफ टाइम. जब न्यू केसेस कम होंगे तो एग्जिस्टिंग केसेस भी कम हो जाएंगे. डिड यू अंडरस्टैंड? महक समझ में आया? ठीक है, ऑलराइट. ओके, चलो लेट्स सी व्हाट इज द डिफरेंस. पूजा इज आस्किंग कॉजालिटी एंड टेम्पोरलिटी. ओके, कॉजालिटी में बच्चे यू नीड टू हैव ऑल द हिल्स क्राइटेरिया. ओके, कॉजालिटी शुड हैव ऑल हिल्स क्राइटेरिया. ऑलराइट. Temporality is most important Hills criteria, which says that cause precedes effect. Okay, cause precedes effect. Smoking leads to lung cancer. So temporality is one most important Hills criteria. But when we have to demonstrate causality, we always have to look at evidence-based medicine. ठीक है? Okay, let me take up question number 6. New treatment. Now this I told you, ठीक है, new treatment has come which is delaying death but is not producing recovery. ठीक है, it's not letting patients die. जैसे ART मरने नहीं दे रहा लोगों को, but आप उसके संग ज़्यादा दिन जी रहे हो तो D increases, so what happens? P increases. But if you, अगर आप ठीक हो जाते हो, D decreases, P decreases. Clear? All right. Okay, primary data means I am going to collect the data myself. Secondary data, I am taking the data from existing records. ठीक है? Okay. अलेक, मीठी को लाना है. Okay, all right. ठीक है. So those were the questions. Screening we are going to discuss tomorrow. Updates also we are going. दे दो. Updates also we are going to take up tomorrow. दे दो. Okay, all right. 27th one. What was the 27th one? Okay, I think we are done now. Baby is crying. Yeah, least evidence for making a clinical decision. ये किस स्टडी से आप कैलकुलेट करते हो? लीस्ट एविडेंस आपको कौन सी स्टडी डिजाइन देती है? ठीक है, लीस्ट एविडेंस. नाउ अगेन एविडेंस बेस्ड पिरामिड विच इज द लोएस्ट वन ओवर हियर, इकोलॉजिकल स्टडी. ठीक है, चलो नाउ आई थिंक आई हैव रैप्ड अप. सो देयर विल बी अ टेलीग्राम क्विज एट 8 PM. ओके, सो यू विल लुक एट दैट. स्क्रीनिंग टॉपिक कल होगा. ठीक है, टेलीग्राम क्विज विल बी बेस्ड ऑन दिस वन ऑल्सो. ठीक है, ओके. Attribute for assembling cohorts, all considerations are taken except forward looking study. Yes, it is prospective. Yes, all right. Attributable risk epidemiologist के use में आता है. ठीक है, so rest everything will be discussed. 27th I'm not able to find the 27th one, so you can send me the 27th one later if that's okay. 27th was over here. You just had to do ABCD. ठीक है, और इंसिडेंस एक्सपोज्ड नॉन एक्सपोज्ड वो फॉर्मूला लगा के क्वेश्चन निकल जाएगा. ठीक है, चलो. सो बाय बाय एवरीबडी, आई सी यू सून टुमारो अगेन. जस्ट अ क्विक लुक एट द रोस्टर गाइज. कल होगा तुम्हारा, एंड डोंट वरी अबाउट द images का सेशन विल बी कंडक्टेड सेपरेटली वेयर आई डिस्कस अगेन एपिड इमेज वाइज. कल द चैप्टर इज screening, so I am supposed to see you all tomorrow at 2 PM for screening. Okay, bye bye, thank you so much, I'll see you soon. Okay, take care. So attend the telegram quiz at 8 PM everybody, and I will share the PDF in a little while. Okay, put the baby to sleep and then I will check the PDF. I'll share the PDF. Okay, keep studying, keep revising, don't give up. Okay, keep studying, keep revising, don't give up. हो जाएगा एग्जाम. ठीक है, we all are with you. Okay, bye bye, take care guys, stay blessed, eat your lunch. Okay.